Hello, my name is Ritu Chanagiri, and I'll be speaking to you today about the regional distribution of systemic cancer, specifically looking at how Florida's incidence is higher compared to the rest of the US, despite a national and Florida trend of decreased incidence in the last 30 years. About 6 per 100,000 people is the incidence rate of gastric cancer in the US. And unfortunately, in Florida, it is actually a higher incidence rate. Specifically, this can be likely attributed to the melting pot of the multiple high risk ethnicities. And thus, this brings to light an urgent research that is needed to understand the specific burden seen in Florida. In this study, we compare the disproportional contribution to incidence of the gastric cancer in the US and emphasizing this need to improve interventions to offer to Florida patients. The methods of the study included using the Global Burden of Disease Protocol, which is widely accepted and comprehensive in order to best estimate the burden of gastric cancer in the US and in Florida. To further verify the accuracy and generalizability, we assessed via the Joint Point Regression Program and conducted statistical analysis to look at the data from the temporal trends using the reference joint point models. The results of this study are alarming and call attention to the action needed to be taken. For example, the incidence of gastric cancer has decreased in males and females since 1990, with a more rapid decrease in males than females. However, a higher incidence rate at the start and end for specifically Florida males compared to the US males, US females, and Florida female rates. Furthermore, the mortality from gastric cancer is higher again in males than females nationwide, and specifically for Florida males and Florida females compared to the US. Once again, Florida male is having the highest rate of mortality. The dailies, which are the disease-adjusted life years, have also declined as a national trend, but once again, showing that in Florida, there are higher rates for males compared to US males, US females, and Florida females. Interestingly, and disproportionately, Florida males and females contribute to about 7% of the national gastric cancer-related deaths. The ACE standardized death rate, the ASDR, demonstrates that there is a lesser decline in magnitude in Florida compared to the rest of the US. Once again, the males in Florida having the highest rates, being 132% higher than the rest of the US. And shockingly, a statistic that is an estimate of about 1 per 100,000, being that Florida has a higher incidence than the US at the starting and ending of this study period. The important discussion and conclusion is that despite the general decline in ASIR, Florida's figures are much higher among males, and this is likely attributable to the unique demographics present in Florida. Florida faces a significant healthcare challenge in managing gastric cancer, which indicates that broader national issues must be addressed and using specific strategies for Florida. Strategic actions such as targeted screening, improved early diagnosis, and enhanced treatment options are important for mitigating the rising gastric cancer trend in Florida. This study is an urgent call to healthcare professionals to prioritize and strategize against this growing threat to public health in Florida. With this, Florida outcomes can be on par or better than the national trends.